Hello, and welcome to this snapshot on epinephrine autoinjectors and expedited partner therapy. We're covering two topics in this snapshot. This is part of the Medical College of Wisconsin's School of Pharmacy, Wisconsin MPJE Review in Module 8. Our first topic will be epinephrine autoinjectors. So Dillon's law is inspired by a Wisconsin boy named Dylan Mueller from Michigan, who unfortunately died from an anaphylactic reaction to a bee sting. This law allows authorized individuals and entities to possess, and those individuals to administer epinephrine delivery systems. Now, these epinephrine delivery systems include epinephrine autoinjectors as well as prefilled syringes. They may be administered to individuals who are believed in good faith to be experiencing an anaphylactic reaction, or when possible or necessary, to give it to the individual's parents or caregivers to administer. The entities in question include businesses or events at which allergens may be present. So this can include a summer day camp, for example, or a sports stadium or event. It's left very general in our law. It also applies to schools who can be prescribed epinephrine, and we'll talk more about schools in just a little bit. So under this provision, physicians prescribe the epinephrine autoinjector in the name of the authorized entity or the individual. The individual can be an employee or a designee of any of those authorized entities that we discussed in the last slide. This is another example of where the name on the prescription and on the prescription label might not be the same as the name of the ultimate user, the person to whom the drug is ultimately prescribed. If it is an authorized individual, so someone who is either being prescribed this directly or who is administering an epinephrine autoinjector as an employee of an authorized entity, that individual must have training every 4 years in the administration of epinephrine and the emergency detection and follow-up of anaphylaxis. So there's a training component to being an authorized individual. Schools are slightly different. Under this law, school nurses can administer epinephrine to a student with a prescription for it. So they can administer one of the school's epinephrine to a student that has a prescription on file with them. Or they could administer their own epinephrine to a student undergoing anaphylaxis if they have a standing protocol with a prescribing physician. What's the pharmacist's role? Again, the name on the prescription label is the name of the authorized individual or the entity that is indicated on the prescription. And again, it's an exception to that patient name on the label rule. Pharmacists must also counsel on the administration and the use of the autoinjector. They're usually fairly simple to use, but they do require a small amount of counseling to be able to use effectively. And it is also important that they counsel on the signs and symptoms of anaphylaxis and how to follow up after an anaphylactic reaction. So in January of 2023, Wisconsin's Department of Health Service issued a statewide standing order. And this standing order allows pharmacies to dispense epinephrine autoinjectors or prefilled syringes to an authorized entity and its employees and agents. Okay, so this does not cover schools, but this is just for the authorized entities like day camps and other events and its employees and agents. In red above me is the URL. And if you're interested in seeing what this looks like, you can go to that URL and take a look at the actual standing order itself. To be able to participate in the standing order, pharmacies must verify that the authorized individual has undergone the training. So that person must show proof that they have undergone that training that you have to do every 4 years. Pharmacies must train their pharmacists on the standing order. It's about a 1-hour training and includes things on, how to comply with the standing order, how to counsel patients, that type of thing. And then dispense the epinephrine. They'll issue a prescription, number the prescription just like a regular prescription, and maintain prescription records as per all the other state laws we have in place. Okay, so let's talk for a moment about expedited partner therapy. Expedited partner therapy is intended to prescribe, dispense, or furnish to a patient an antibiotic to be used by a sexual partner of the patient. So the purpose here is for pairs of individuals who have sexually transmitted diseases to make it easier to treat both partners with those STDs without having to see both or have them both come into the pharmacy. So the intent is to decrease the spread of disease, prevent ping pong infections, that type of thing. It is an exception to the prescriber-patient relationship. And again, as we'll see, it can be an exception to patient name on the prescription and label general rule. There are 3 diseases for which expedited partner therapy can be used: chlamydia, gonorrhea, and trichomoniasis, and it's important to know these 3. Wisconsin is not alone in authorizing expedited partner therapy rules. So 46 states throughout the country have definite expedited partner therapies rules in place. And Wisconsin is one of them, as are its surrounding states. So what happens if the practitioner doesn't have the name of the partner, or the other partner doesn't want to give their name? They may indicate EPT, or expedited partner therapy, on the name of the prescription. Okay, so if you get a prescription and it has EPT, or expedited partner therapy, that's what that is. The pharmacist may indicate this on the prescription label if the patient name continues to be unknown. So instead of patient name, you can have EPT, or expedited partner therapy. It is important that in order to be able to do this, there is a legal obligation for the pharmacist to ask about the partner's allergies first, okay, making sure that we're not dispensing something they're allergic to, and for them to counsel the person receiving the prescription to stop taking this antibiotic if allergic symptoms develop. So this is a legal requirement to confer immunity from liability for the pharmacist for dispensing under expedited partner therapy. Well, this has been a short snapshot on epinephrine and expedited partner therapy, 2 exceptions to the patient name on the label rules, part of course, of MCW School of Pharmacy, Module 8. And we have companion questions available for further practice. Thanks, and I'll see you in another snapshot.